Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
If there is treatment of bilateral cornual block. The treatment of bilateral cornual block, the most common cause of bilateral cornual block is physiological sphincter of spasm. If there is physiological sphincter of the spasm, then take a guide wire and under hysteroscopic guidance pass the guide wire into the tube. This is called as hysteroscopic cannulation. This hysteroscopic cannulation is followed by laparoscopic pertubation, where you give a dye into the uterus, and this dye passes through the fallopian tube, and you can see the dye coming in the from the fimbriae into the abdominal cavity. So this is seen by laparoscopically. So most of the time the block is relieved by passing the thin guide wire under hysteroscopic guidance. If it is not relieved, then it definitely means it is a pathological block. The most common cause of pathological cornual block is genital tuberculosis. Then the best treatment in such case is in vitro fertilization.
thank you and thank you for watching.